Morning, everyone. Thank you for joining us. This is the Aurora Health Alliance Kids Interest Group meeting. So let's go ahead and get started. I'm going to turn it over to Mary Jo Paladino from Family Voices.
Well, hello, everyone, and thank you for inviting me to introduce the Family Engagement and Systems Assessment Tool, otherwise known as the FESET, and to talk to you about what it is, why it was created, and how to use it. I'm Mary Jo Paladino. I'm a program coordinator with National Family Voices, and I'm located here in Colorado. In case you're not familiar with Family Voices, just briefly, Family Voices is a national family-led organization of families of children and youth with special healthcare needs and disabilities and professional partners with a network of Family Voices affiliate organizations and family-to-family health information centers throughout the United States, the U.S. territories, and tribal nations. In Colorado, Family Voices Colorado is the Family Voices affiliate organization and the Family-to-Family Health Information Center. And Christy Blakely, the executive director, will present on the services and supports available through Family Voices of Colorado following my presentation. There are different ways for families to be engaged, and family engagement occurs at many levels, all equally important. As we move along the continuum of family engagement, boxes are bigger because engagement affects increasing numbers of families. So we have individual engagement, advisory engagement, moving up to systems level engagement. Systems level, where families actually partner with organizational staff and work together to create policies and programs, practices, or services that affect all individuals and families served by that system, reduces systems fragmentation, can remove barriers, and improves quality of care. Family Voices developed the family engagement systems tools, which are for assessing family engagement for all families, not just families raising children and youth with special healthcare needs. The tools were developed with guidance and input from an expert work group, which included family leaders. Cognitive and pilot testing included families and their professional partners from Title V, Medicaid, Children's Hospital staff, pediatric practices, and Early Childhood Collaborative, a nonprofit foundation and its family advisory group, Original Genetics Network, and others. It's important for the individuals and families who receive services have a voice in the creation of the policies and practices that govern those services. As without family engagement, systems may inadvertently create barriers to access to care or to other services and support. So the what, the how, where, when, why, who, that's we Family Voices strive to address when we started researching and developing a framework for family engagement in systems level initiatives. The definition for systems level family engagement that we used is authentic partnership between professionals and family leaders who reflect the diversity of the communities they represent, working together at the systems level to develop and implement better policies and practices. And what we mean by a family member or family leader, it's a family member with lived experience who can participate in systems level activities around policies and programs that affect the broader population of individuals who receive the services. So to fill a measurement gap, Family Voices created the Family Engagement and Systems Assessment Tool, otherwise known as the FESET, and it's a 20-item tool to be completed by families and organizational staff who participate in an initiative. A family engagement systems toolkit, and I'll refer to that as the toolkit, is a compilation of strategies and resources for improving family engagement. And we also created the FESET User's Guide to walk you through using the tools. The FESET and the toolkit can be used separately or as companion documents. For example, once an organization assesses a systems level family engagement initiative, they could explore the strategies and resources in the toolkit to improve family engagement in future endeavors. These tools can be used to assess how well an organization is engaging families in systems level initiatives. So there are 3 uses for the tool: to plan, to assess, and to improve as an equality improvement initiative. Planning is the first first engaging families in a systems level initiative. Might want to use the checklist in the back of the toolkit to identify what your organization is already doing to ensure meaningful family engagement and what other strategies you might want to implement. So that's use 1, to plan before the initiative starts. Use 2 is for assessing how you are doing. If already engaging families, have the families and staff complete and score the FESAT, discuss the findings, and identify domains of strength as well as any domains where there's room for improvement. Then explore the toolkit and as a group, select 1 or more strategies to implement to improve future engagement. And the third use for assessing engagement over time, taking action along the way to improve areas you have identified in need of improvement. So you'd use the FESAT and the toolkit to track progress in family engagement efforts. Complete the FESAT and use the results as a baseline score. Identify an area for improvement, select a strategy from the toolkit to help, and then complete the FESAT again at its scheduled interviews and compare results to baseline. So let's look at it more closely. Use 1 is to plan. If an organization is first working to engage families in systems level initiative, such as an advisors on an advisory council, staff can use the checklist to help guide the design of the initiative. Using the 20 items in the FESAT, we created a checklist to help guide the design of the initiative and ensure families have the supports they need to participate and contribute to their maximum potential. These 20 items are organized within 4 domains: commitment, transparency, representation, and impact. Responses to the 20 items on the checklist are yes or no, somewhat, or don't know. Organizations can use the checklist to see what they may already have in place and identify what else they might want to implement to ensure meaningful engagement. The toolkit then has strategies and resources for those 4 domains and 20 items to help with efforts for items identified to implement. So this is a picture of the checklist to guide design and is found in the toolkit that can be helpful for use 1 to plan. The next few slides will introduce you to the FESAT tool. The FESAT is intended for use 2 and use 3 to improve. So use 2 is to assess and use 3 is to improve. It is organized by the same 4 domains mentioned in the previous slide for the checklist. The 4 domains of family engagement and the key criteria that support meaningful family engagement and systems level initiatives are identified in the framework for assessing family engagement outlined in the issue brief. I have a link at the end of all of these. I have a link at the end for all of these materials mentioned. Okay, so this slide is domain 1, commitment. It gives a definition for commitment followed by 5 items. So commitment means that the organization routinely engages family leaders in all systems level initiatives that affect the policies and programs that govern services for children, youth, and families. And then it's followed by 5 items. And I'll just read the first one. I won't read through all of them. The organization uses written policy that requires family engagement in systems level initiatives. And then the responses are different than on the checklist. So In my experience, the organization uses written policy. You could respond never, rarely, somewhat, usually, always, or not sure, or not applicable. So the group of families and staff from the organization can complete the FESAT individually or in separate groups. For example, the staff together do it and family leaders do it together. And then with those results, meet together either in person or virtually to discuss similarities and differences in the responses. And the idea is then after those discussions, come to a consensus score. And through that, and I'll share the score sheet a little bit later, it's easy to identify maybe priority areas that the group might want to work on and develop an action plan around. Teams have found that this discussion part of the process to be extremely useful. It's opportunity for each other's perspectives about how well the organization provided the supports and information families need to make a meaningful contribution and feel heard. And it's a time for organization staff perspective to be heard about how well they are doing. So this slide is domain 2, transparency. A key item in this domain is mentorship. Based on research and key informant interviews, having a mentor, either another family leader or someone from the staff, to help orient family partners to the work, review materials and prep for meetings, help to increase their confidence and help them make meaningful contributions to the initiative. This is domain 3, representation. It's important to recruit and partner with family partners who represent the community served. And domain 4 is impact. Really important. If you had that experience where you've provided input via survey or suggested something at a meeting and no one ever followed up to share on how that information was used, these items in the impact domain are a way to close the loop and asks how the organization used families' ideas. So I mentioned the score sheet. This is a picture of the score sheet. So again, after scoring individually and having that discussion of the similarities and the differences in responses that everyone made, you can enter consensus scores on the consensus scores into the score sheet. And the answers convert to numbers. So for example, a response of never would be a 0, rarely is a 1, sometimes a 2, and so on. And for not applicable or not sure, you leave that blank. This data can help inform the group on a domain and or specific area that the group may want to prioritize for improvement and develop an action plan for. So you can see the scores automatically can convert to the bar graph. My words aren't coming out clear today. And you can see in this bar graph, maybe representation might be an area that the group would want to look at improving. The toolkit includes both strategies and resources. Here's an example of an overarching strategy about the importance of collaborating with the family-led or community-based organization to identify representative families, ensure they have needed mentorship and support, and that both family leaders and organization staff have access to skill building opportunities. This section of the toolkit provides examples that make partnership between systems of care and family-led or community-based organizations a win-win. Examples include capacity building, data sharing, helping identifying, recruiting, and support family partners, and much more. When used in combination with the FESAT, the toolkit can be used to plan how to respond to issues that the staff and the family leaders identified. In addition to the overarching strategies and resources, the toolkit has sections for each domain. This slide is for domain 3, representation. Some strategies in the toolkit address issues that we consider to be important, but that were too complicated or too nuanced to address as an item on the fee set. For example, the strategy to connect with community liaisons, cultural brokers, family-led or community-based organizations to help identify and support diverse, marginalized, and underserved family leaders. This strategy is a powerful approach for improving the diversity of family leaders who you work with and is relevant to all of the items asked in the representation section of the fee set. It applies to some items asked in other sections as well. However, there's so many different ways of doing this that it was impossible to address with the fee set question that would make sense across all kinds of initiatives. The representation section of the toolkit also includes several other strategies that are not linked to specific questions in the representation section, but that will help improve both the diversity of family leaders you work with and the quality of your family engagement efforts overall. The third use to improve. So we talked about planning using the checklist to assess where the organization is at a certain point in time. And the third is to improve over time. So back to that example, the Family Advisory Council. When the Family Advisory Council and staff identified this issue that families were not representative of the population served and needed to provide stipends and recognition of families' time and expertise, they selected strategies to implement from the toolkit to increase diversity of the advisory council and provide stipends. After 12 months, they completed the FESAT again and compared results to their baseline score and found improvement. Families on the advisory were representative of the population served. They successfully implemented a plan and process for paying families for their participation on the advisory council. So we've talked about the three uses for the FESAT, introduced the toolkit and the score sheet. I have a slide. I'm going to hold questions for a moment. Here's contact information to download these materials. And my contact information and my colleague Beth Dwortsky, if there are requests for further information or technical assistance, we're available for that. And I'd like to thank you and turn this over now to Christy Blakely, who is the Executive Director of Family Voices Colorado, to just introduce Family Voices Colorado and their resources and supports.
I'm Christy Blakely with Family Voices Colorado. I want to encourage you to utilize the services that we offer. We are all about improving healthcare access and equity for children and youth with special healthcare needs and disabilities. Go ahead to the next slide. We work in both direct service with families, helping them navigate the healthcare system, which is pretty crazy in the state of Colorado, I must admit. And we also work at the policy level because families inform us of the changes that need to happen or the challenges and barriers that they're seeing. Length of time from application to service in today's world is somewhere between 6 and 8 months to get onto a waiver. We are all about the home and community-based service waivers and helping families navigate, figure out which waiver is best. We work a lot in the dual diagnosed in IDD individuals with developmental disabilities, as well as in the healthcare system and needing services. We look at what is out there and help identify what needs to change or how things are changing. We currently are involved with healthcare policy and financing, our Medicaid agency, to put a pause on the certified nursing assistant CNA hours because we were seeing children with autism getting less hours in home health care. And so we went to healthcare policy and financing and said, stop this, because these families with kids with autism are not getting the same kind of service hours as children with physical or other disabilities. And that wasn't okay. So that's the equity piece. We work very hard to improve what's out there and improve the services. We really help the families navigate. Next slide. Here's some of the things that we're doing. We are the Family to Family Health Information Center for the state of Colorado. We are currently doing a deaf-blind intervener community pilot. We're in year 2 of that pilot. And what we saw were families that were saying, we only get services in the school for interveners for children with deaf blindness. We don't get anything outside of the school. There are no services. And so we started a pilot. We're in the end of year 1. We're going into year 2. We're looking for children in Arapahoe, Douglas, and Elbert counties, thanks to some funds that came in from developmental pathways, as well as all along the Front Range. We want to go beyond the Front Range soon, but we're not there yet. We also have been able to identify through that we need a deafblind navigator for families that find out that their kids have deaf blindness. It's not a one place where they find it out, like kiddos with Down syndrome. Deaf blindness kind of comes from 2 different sets of providers, and then there's really no resources. So we're picking that up. We do help families navigate as well as providers, because often providers don't know where to send families and what to do for families. We do the advocacy. We address those barriers. We work with families to not only do the Medicaid appeals. We're one of 3 agencies that do that. Cross Disability Coalition does it, as well as CCLP, Center for Law and Policy in Colorado. We also work on identifying the barriers. So right now we're seeing some barriers to access in durable medical equipment. And so we're working on that. I'm in the process of hiring a Spanish language navigator as well. We're all families. We are all parents of children with special health care needs. 40, which makes me super old. But that's okay. I had her when I was 12. Accurate information, both on social media. There's a Denver platform for kids, families of special needs. Making sure that the information parent to parent is accurate is one of the things we do. So we monitor those websites or those social media platforms. We collaborate with organizations as well. And we are in the process. One of the families said, can I have therapy and have somebody do CNA services at the same time? And nobody knew the answer. And healthcare policy and financing policies are very vague. And so we are convening a co-occurring services meeting where we're actually laying out, can you have certified nursing assistant at the same time as physical therapy or hippotherapy or community connector, all those kinds of things that nobody's answering. Family Voices has been facilitating the advisory for children with disabilities with healthcare policy and financing for over 20 years. That meets on the second Wednesday from 10 to noon. And it's virtual right now. And that is one of the places where we not only do the information sharing, but we also identify the barriers and have a platform within the state government to really move things forward. Next slide. The intervener is a new term to very robust program, but we are just now, there are certifications and all sorts of ability to get licensed as an intervener in the state of Colorado. We also, in this intervener pilot, have funding to assist with scholarshiping so that we can increase the workforce of interveners. But an intervener is kind of like a parapro on steroids because they're doing not only the vision part, the eyes, but they're the ears. And so there's a communication component. We're seeing amazing data out of this pilot. And our goal is to go to legislation. So following up with Mary Jo's presentation, we're going to be making systems change at the legislative level to place this pilot into a state program in the state of Colorado for children, which it doesn't exist at this point. So we're going to be asking for money. But this, we are seeing children experience their community for the first time. And whether that be library hour or a reptile store or a playground or a church system service, it doesn't matter to us. It's outside of the school day that children are learning to experience and understand what their environment really includes. Last slide. This is who we are at this point. I'm in the process of hiring one more staff. But Megan Bowser is a parent of a child with deaf blindness. She is my deafblind navigator, as well as a navigator of all systems. And I am Christy Blakely. So I can answer any questions or ask questions to Mary Jo. I explained that all of those documents are free and downloadable. And I've used the tool, the FESAT tool with systems. And I haven't used the whole tool. I've used the areas, the domains that the folks really wanted to work on. So engagement, really evaluating, the engagement piece. Or do we have people that are engaged? So it's an amazing tool. And again, you don't have to use the whole thing.
Well, let's move on to our next presenter, just to be mindful of time. I wanted to introduce a Precious Child folks partnership with Children's Hospital. Thank you so much for being here. I'll turn it over to you.
Awesome. Well, good morning, everybody. My name is Sierra Esparza. I am a programs coordinator at A Precious Child, and we also have Maria Martinez. She is our resource center director. We are kind of partnering with Children's Hospital this year by bringing them a satellite resource center. I'm kind of going to go over just a few slides that we have about what A Precious Child does, what our programs and services are, and then also a little bit about how to become an agency partner with A Precious Child. And Maria will kind of touch on our satellite resource centers and how we can bring those to the community as well. So at A Precious Child, we have been operational for over 13 years. We're getting ready to celebrate our 14th year in November this year. And so just a little bit about us is that we really focus on helping children and their families challenged by poverty, abuse, neglect, or crisis situations on their path to self-sufficiency. We really provide children in need with opportunities and resources to empower them to achieve their full potential. A Precious Child really envisions a future where every child can grow up to be a secure, self-reliant, contributing member of their community. And so with our collaboration, all of the clients that we serve at A Precious Child are referred to us by an agency partner. Agency partners are really these community organizations that we work with. And so throughout our 8-county service area, we work with more than 561 agency partners. Some of the partnerships that we have are with health and human service organizations, schools, churches, shelters, kind of you name it, we work with them. All of the programming that we have at A Precious Child falls into our Cradle to Career initiatives. And so we really focus on 5 different initiatives within our programming. So we focus on child and family advocacy, family stability, academic success, social and emotional well-being, and workforce development. So with our first initiative, we have our Empowerment Center. This provides holistic resource navigation and clinical case management through wraparound support and education services, which really helps all of our families and children reach their path to self-sufficiency. This is the first stop for our clients. So when they call and make an appointment with us, they're able to go into our Empowerment Center and talk through a lot of different topics with our case managers and Empowerment Center advocates. So it really gives all of our clients the opportunity to work through their different goals or situations they might be experiencing. Next, we have our Family Stability Initiative. We have 3 different programs here. First will be our Precious Essentials program, which is where we are able to provide basic essentials such as clothing, coats, shoes, food, house goods, and hygiene items to families in need. And this is really important for a lot of the families that we serve because it helps to bridge that income gap. And then a lot of our families can then spend their limited resources on living expenses. We also have our Basics for Babies program, which provides basic essentials such as diapers, wipes, formula, and baby gear to families with infants who would otherwise have to ration these items or go without the necessities. These two programs are housed within our resource center. So this is kind of like the second stop for our families once they're done in our empowerment center, talking to a case manager or advocate. They're able to then go shop for these basic essentials through our resource center. Next, we have our satellite resource centers. And so these are basically kind of like an extension of our Precious Essentials and Basics for Babies program, which is where we're actually able to bring resources to the community. This is where we are partnering with Children's Hospital. And so we're able to, or we're going to set up in one of their rooms and basically provide them with all of the racking, all the clothing, and those other like basic essentials in that physical space for the clients and families that they serve. Next, we have our Academic Success Initiative. These three programs are really focused on providing all of those opportunities and resources for children to really maximize their academic potential. And so we have our Inspiring Mind Center, which is really focused on science, technology, engineering, and mathematics-based activities. We have our Edge Essentials program, which is one of our 3 opportunity funds. And so the Edge Essentials Opportunity Fund provides support for anything education related. So we can provide computers, calculators, and tutoring, which then really helps to remove any of those barriers for school attendance. And then we have our Fill a Backpack program, which is one of our largest seasonal programs. We provide backpacks that are brand new backpacks filled with brand new school supplies to children throughout Colorado. And so our agency partners are actually able to submit requests to us, and we can fulfill those requests for them and actually provide them with those ready to go backpacks for whichever grade level they request. Next, we have our Social and Emotional Wellbeing Initiative. We have 4 different programs here. First, the 2 that you guys see on this screen right here are going to be our Give Arts Opportunity Fund and the Give Sports Opportunity Fund. And so these are the 2 other opportunity funds that we offer at A Precious Child. All 3 opportunity funds are really great because you don't have to be a client of A Precious Child to participate in this program. So we do work with non-clients to provide the funding and support for any of the 3 opportunities that they might be interested in. We do have an application process for our opportunity funds. And once all that application and paperwork has been approved, we're able to provide either the physical item. So it could be like a soccer ball or like the pads and equipment for football or a musical instrument. We're able to provide that physical item or up to $250 towards whichever opportunity that child or family is interested in. The other 2 programs that we have here are our Precious Gift program. And so with this program, we're able to provide gifts to children who would otherwise go without during these really special or monumental times in their lives, such as their birthdays or during the holiday season. So our Holiday Precious Gift program is also one of our largest seasonal programs. We're able to, again, receive these requests from our agency partners, and we can then get those requests fulfilled throughout the community, and they bring those all of the gifts back to us, and we're then able to distribute them to our clients as well as our agency partners. Next, we have our Precious Mentor program. And so this is one of our newest programs at A Precious Child. We've really seen it blossom in the last year that it has been up and running. And so it has 3 different components to it. First being a peer-to-peer mentorship, which is where we're able to provide youth with that, like, again, peer-to-peer relationships. A middle school student is paired with a high school student, and they're able to talk through whatever they may need to, like homework, social life, anything like that. Next, we have our community-based adult to youth mentorship, which is where either a middle or a high school student is paired with an adult within the community, and they're, again, able to really work through anything that the youth or mentee might be going through. And then finally, we have our workforce development mentorships, and this is really where we're able to provide the youth and the mentee the opportunity to work through anything that might be related to their career interests or any job or anything like that. So if we were working with a mentee that was interested in graphic design, we would actually be able to pair them with somebody that is in the graphic design field so that they can really get a lot of that mentorship on, like, this is what you should put in your portfolio. This is what you should be putting on your resume to really stand out to a lot of these jobs. Finally, our last Cradle to Career initiative is our Workforce Development Initiative. And so through our social enterprise coffee and gift shop, we're really able to provide youth who are ages 15 to 24 that are out of school. They might not have employment or are struggling with a learning disorder. We're able to provide them with the opportunity to work through any situation they might be going through. They are able to go through a work-based learning boot camp, and then we can really help them work through any of the skill sets that they might be struggling with or that they just never really learned in the first place, which then helps them to obtain and retain employment. So we work through a lot of these hard and soft skills, such as like working through attitude or working with time management. But then we also help them work through, like, this is how you manage a coffee shop. This is how you manage the inventory in the gift shop and how you can think like a manager in that setting. All of our Precious Perks participants are also paired with, again, that workforce development mentorship, so they can really, again, work through any of those skills with a mentor who is in the same field and whatever career interests that they have. So those are all the programs that a Precious Child has. We do have 11, so it is, again, a lot of information. I'm sure that we can also send out this PowerPoint with kind of the follow-up notes after this meeting. But then in terms of how you can get a client involved with all of our programs, we do have our referral voucher. And so with an active agency partner, this is really what we look for when an agency partner does refer a client to us. We don't really ask too much information, as you guys see here, because this really is all that we require. And so again, we do ask that only agency partners are basically submitting these referrals to us, because we do have a process for how we really ensure that clients are in need and that they have been vetted by our agency partners. But this is really how we're able to get all of our clients into our doors and in for an appointment. This referral voucher is for, again, kind of what I was talking about earlier with that first stop and that second stop. When they do call for an appointment, they can go through our empowerment center, and then they can also go and shop through our resource center. For all of the other programs and services, we kind of have a few different, I guess, like points of contact for those programs. So we have a lot going on at a Precious Child. I will then turn it over to Maria to kind of talk a little bit more about our satellite resource centers.
Hello. So like Sarah was talking about our satellite resource centers, we currently have 50 satellite resource centers all around the Denver area. And we are all the way down in Weld County, Aurora, Arvada. We kind of have them just everywhere where we see the highest need. The biggest thing for our satellite resource centers is that we're trying to get into the communities where we see a really big need for transportation, families that just are not able to come all the way to Broomfield or just have emergencies. Obviously, a lot of schools have those needs. So we do have a lot of our satellite resource centers in schools. There's a couple of housing units. We have our largest one at Adams County Human Services. But what the satellite resource centers are used for is if a family has an emergency or even a child and they need something on hand, we try to have these places in different locations so that they can just come in, go and get a packet of diapers, go and get clothing, shampoo, kind of depending on what the resource center is able to hold. And then at the time, that's a touch point to be able to see if that family is a first-time user of a satellite resource center, then they can get referred to a precious child, because we ask that we do refer clients to a precious child just because of all the other items that they're able to get here, plus our caseworkers, and just be able to use our full solid resource center here. Once a family is referred, then we ask that they come here as the main location, but they can always access these satellite resource centers for emergencies, or if they run out of diapers, things like that. Depending on the location that an agency has for us, we have satellite resource centers that are 4 rooms. We have some that are literally a space in a closet that they were able to make. We really try to make them fit to the location where they're at and who they're helping. So some of them have only clothing. Some of them have diapers, clothing, toys, books, shoes. Some of them have only baby clothing. Some of them have clothing for adults, kids, and infants. So we really cater the satellite resource centers to your location, to what you need and who you're serving. For the satellite resource centers, there is also an application process, and we do currently have a wait list. But anyone who is interested in that, there is a process where we would connect you to Addie, who is my person who manages those permanently. You would then do an application to see if your location fits within the standards of what we need and the people that we serve. When we do that, then we go in, we do a tour just to check out kind of the spacing that you have available, see different options for what we could make work. Most of the time, we will be able to provide all the racking, we provide all the hangers, and of course, we provide all the items that come into these satellite resource centers. At times, if locations do have a grant that can help support with that, then that's even better for us because it helps be able to have more inventory for more locations. What we do after that is we come in, we see the space, kind of figure out what works, what kind of racking, what items you would want, and then we get it all set up for you. After we get everything set up, we do our training for our portal. We don't ever ask that you track kind of like anything that a client is taking or how often they're taking it. We just ask that we get demographics for each client you're serving. So there's a training process that we would go through to kind of teach everyone how to do that and how to track who we're serving. After that, kind of the main things that happens is every time that a satellite resource center needs inventory, you're able to request that and we refill your satellite resource center for you. We will either drop off items or come in and put things away. Kind of depending if you have volunteers or if you just don't have time, you let us know and our staff will be able to put clothing away, refill diapers, hygiene, all that for you. The request for items that are needed can come in as often as possible. Of course, we are inventory or donation based. So depending on what we have and how often we have it, then we fill you up as soon as possible. That way you just keep on serving clients as needed and we are the ones that will come in and refill you or support at any time if you're moving to a different room or you have hangers that are breaking and you need more, things like that. We really take that on as our work on our side. And then we just ask that we have a liaison dedicated at each location so that we can reach out to them and know how things are going, if something's not working or what we can do better, and all of that. We're currently in the process, like Sarah said, of opening 2 for Children's Hospital. So it kind of just, it's what your location is able to cater to. And then what you need, things like that is kind of where we start the talking process of how we can move forward with each person who applies for that. So yeah, that's kind of what we do all around with services here at our resource center, agency partners and our satellite resource centers, which are at your locations, and we manage that as well. But yeah, if anybody has any questions for me or Sierra, we would be happy to answer any of that.
Thank you, Maria and Sierra. Can you say a little bit more about when the plan is for the satellite at Children's to be up and running?
We currently have those set up for, I believe, in a couple of weeks to get those actually set up. We just got all of our paperwork back and everything is good to go. So we are just having it on our calendar now for us to go out there and get that done.
I did see a few questions came through. We'll probably just do one or two questions. How have you faced the formula shortage challenges?
So for us on the main resource center, we've been super short on formula as well. We've had agencies like Tri-County Health Department, just schools in general reach out and ask if we are able to provide any formula for anyone. Of course, right now we barely have formula to be able to sustain our clients here, but we've been lucky enough to apply for some grants and we're able to get some funding in. So pretty soon we'll be able to restock on at least some formula. We've had amazing donors who have just literally gone out and anything they can find on shelves, they'll get it for us and donate it here. We have been able to help Tri-County Health Department when they just don't have anything and we magically have it and we're able to get that for them. So then they do emergency pickups and emergency requests for us. So that's just another piece of being an agency partner. If you have an emergency of something that you're lacking, which would be diapers, formula, a stroller, or something, as an agency partner, you're able to email me or my team and let us know something that you're looking for, something that you're in need of. And then once we have that for you, we let you know, and then you pick up and give to your client. Then they don't have to wait the every 4-month period of them coming into shop. For our satellite resource center locations, as long as you're within our 8 counties that we serve, we are pretty much able to get away with opening as far, like I said, we have one in Weld County that's 2 hours away from us, and Weld County is an area where we're really trying to help. We know that the need is there, and it's definitely a long drive for families who are struggling for gas or groceries, things like that. So we're really trying to target Weld County, Longmont, Aurora. So yeah, any location, reach out to us and we can see what we can work out.
Thank you so much.
Thank you, guys.
Yeah, thanks for the work you do. Other questions? We'll move on to our last quick overview with Elizabeth, Tri-County Health around vaccines, and then we can come back to if there are other questions or information that folks would like to share. And yeah, so I think Elizabeth, thanks for joining us. I'll let you take it away.
Good morning. My name is Elizabeth McGee, and I was invited by Laura Dawn to come and join this group and talk a little bit about the what I like to affectionately call baby vax for COVID. So I am the lead, our titles like change all the time. I think we're now like community lead strategists or something like that on the COVID team for the partnerships and strategies side. So we handle mostly the vaccine stuff, but we do have the other side that works on the epi component of COVID. Right. So I'm going to talk just give some really basic information today about the baby vax. If there is any questions or concerns or confusions after we talk, you're welcome to ask questions, or you're always more than welcome to email me with any questions. And I did put my email up in the chat. So products and dosing for our baby vax. We have 2 products for our little ones, 6 months through 4. That's both Pfizer and Moderna. Pfizer is a 3-dose series. Moderna is a 2-dose series. The spacing is the same as we have for adults. So Pfizer is 28 days and Moderna is 21 days. We're seeing, I just had a conversation last week with CDPHE and the team that does a lot of our mobile bus vaccines. And we're seeing that Moderna is really the most popular so far with parents, most likely because it's just the 2-dose series. So it's about a 3-to-1 uptake of Moderna over Pfizer. Currently for providers, we do have fewer providers for baby vax, and that's just based on the fact that we're vaccinating our littlest. So the state decided to pull back on authorizing as many providers. So currently, the providers are our CDPHE immunization team. However, they're currently working on monkeypox vaccinations. So they're not available at this very moment to do our littlest ones. But our CDPHE equity buses, which are the big tour buses that maybe you've seen around the Denver metro area, they are approved to do vaccines for babies. Tri-County and other local health department agencies have been approved, and primary practice providers who are approved by the state are also on that list. We do have a map on our website, and I've just put a picture of that. That shows where those providers are for people, and I will include all these slides to Joe so that you have all these links and information as well. So this is a great resource for families looking to take their kiddos to find that under 5 vaccine. Just some data. I pulled this today, although I'm not sure that this is up to date for the last couple of weeks. So currently our vaccination rate for our baby vax is anywhere between 3 and 7%, 3% in Adams, Arapahoe is at 5%, Douglas is at 7%, and that drops for the completed doses. We are just coming up on that second dose timeline for Moderna. And so that's one reason we see such a lower rate for completed, is that Pfizer is just starting into that that second dose. So that's one reason that you see the large difference in completed versus first dose. Rates are low. We do have feedback that somewhere around 40 to 45% of parents are stating that they will definitely not vaccinate their 0 to 5 year olds, which is concerning. And of course, that's why our team is here, is to work on some of that education and outreach for families to address those concerns. However, we are at rates that we expected. So we're not below, what we kind of thought we would be at this time. So we are still in line with kind of our projected vaccine rates. So for education, we have lots of different opportunities, and we love reaching out to the community and connecting with community partners. We have our team, which if there's any needs, like you need information sheets, or you would like to have somebody come speak to a group or make a presentation on a Zoom, we definitely have a great champion team that can do that. We also have this new information line that I've put on the right, the 720-200-1445. Is a new phone number for the community to call and ask questions. And this can be any COVID question. This isn't just for baby vax. This is a great information resource for families and individuals to reach out to. They can also reach out by email if they would prefer. That is definitely an option. Another thing that we really like to remind people is that we have the ability to plan vaccine events as well. So we can come out to different events, to different partners, and do a vaccine event at a location. So we're really coming to the community. And there's a couple different ways that we do that. We use an internal team, or right now we're using the vaccine bus, that big equity bus. The bus is great because during flu season, they carry the flu vaccine. And they are now, like I said, vaccinating the little ones. Some upcoming events that we're doing in the Aurora area, we're planning about 22 to 23 vaccine events with Aurora Public Schools. And this will mainly be with those preschool to 5th grade schools. However, there are going to be a couple preschool through 8th grade locations. We're still at the very beginning stages of planning those locations, but I will be happy to send out some information on those locations and dates and so forth once we have those solidified. And those events will be available to the community. The majority of schools in APS are really fantastic about keeping those events open for the public. So they have been an awesome partner in our vaccine efforts. That's really kind of all I had. Pretty basic information right now. I'm happy to take any questions. Again, please feel free to contact me with concerns or ideas. If you would like more information about vaccine, I am happy to help.
I have a question. So, well, just thanks so much for all the work that you do, Elizabeth. I want to give you a talking point, I guess, for folks that say, oh, these little kids, they do fine. They just do fine with COVID. Well, my 1.5-year-old was hospitalized because of a COVID complication. So now you can say, oh, I know somebody whose kid went into the hospital because of this. And then I'm looking at Tri-County Health Department does such an excellent job with the Community of Practice newsletter. If anyone wants to be more involved in hearing about community work with vaccines, let me know and I can get you looped in, or I'm sure Elizabeth will know as well. But I'm looking at the recommended COVID vaccine schedules, and for many of them, it's like in 3 to 8 weeks. Do you recommend like 3 exactly, 4, 5? We're all just figuring it out in between doses.
Yeah, it's confusing. So the 3 to 8 weeks is really depending on the age and product.
Mm-hmm.
And so that's why that sort of broad number. Moderna will always be 21 days and Pfizer will always be 28 days.
Okay.
But anybody, babies or adults, have up to 6 weeks to get that second dose.
Okay.
And still, it's full effect.
Otherwise, I want to thank our presenters, Mary Jo and Christy. Thank you so much, Maria and Sierra and Elizabeth. Thank you all so much for the work you do. You all sound like you're very busy. So thank you for taking the time to present about what you're doing in the community. And thank you all so much.
Thanks for having us. We appreciate it.
Yeah, thank you very much.
Thank you.
Thank you.